C or your water circuit, and along with that will come your attachment for either the fresh gas flow on the ward or the ventilator. You'll also need a filter and a mask. First you need to assemble it all together. So if you want to add on to your filter first, so you need to make sure that's between the patient and the flow and the PEEP valve. On the other end where you're attaching this, so if you're just attaching it to the fresh gas flow on the wall, you'll need the white attachment just to add that on there, and then that will attach into the fresh gas flow on the wall, and then on the end you can pop your mask. Show you. Obviously we've added that onto the end, but if you did want to hook it up to a ventilator, you have that attachment that just goes on there if you need to. The other bit is the strap, so when we're actually attaching this mask to a patient's face, is to help attach the mask to the patient. This will essentially go around the back of the patient's head and attach to the mask, but we'll demonstrate that shortly. Other things to show you on the circuit, obviously we have the PEEP valve here. The maximum it goes up to, if you turn it round, is 60 centimetres of water. Obviously you won't be using that on a spontaneously breathing patient, as it's quite comfortable, but that's just how you use that. We've also got the reservoir bag, which here on this standard one is 2 litres, but you can add a 1 litre on one if you want to conserve oxygen that way. Last thing, when that's attached to the fresh gas flow, you probably want it to about 2 times the patient's minute volume for it to be efficient, and also to wash out the CO2 at the end. Obviously if you're concerned about CO2 build up, you can attach a soda lime circuit just at this point here if you need to. Next we need to attach the mats to the patient. So we showed you this before, so this goes behind the patient's head. Obviously you'll probably have someone else helping you, but in this case you hold that to the patient, and these straps attach onto this on the mask. So it has to be warn the patient, it can be quite uncomfortable because we have to have it quite tightly fitting to the patient's face. And then all these go on these hooks here. Like so. Just move your thumb. So that's on there, and then obviously attach this to the wall in the fresh gas flow. So if we're looking at twice a minute volume, it should probably be at least 10 on average for a normal size adult. So make sure that the valve's open, so there's no particular PEEP there, and you can see the bag moving as the patient breathes. Obviously if you wanted to add on a bit of PEEP, you can just turn that as high as you need to. So as you can see, this is as simple as this. You don't need any ventilator, you don't need any electricity. All you need is the circuit, the rest of the equipment, and some fresh gas flow. It doesn't have to be used on an intensive care unit. It can be used in any sort of ward setting or anywhere else you might think of. And finally, in the event of patient stops breathing and you need to intubate, you can also use it in those circumstances. Obviously, this bit here will attach to the tube, and you can they'll either be spontaneously breathing with a tube in, or you can actually manually ventilate using this bag.